Hi all, welcome back to my channel. Here I am going to explain about antenatal examination on a casebook. How you can write. Let us see. So first one is the name of the hospital. So here I am going to write the district hospital, and the registration number of the mother is anything we can write. So I am going to write it here 1182. That is the registration number of the mother. And the ward is, it's an antenatal examination, so that's why I am writing the word antenatal ward. So let us write it here, antenatal ward. Next, look at here, name of the mother. I am going to give the name of the mother as Maya, and her age is 26. Let us write it here, 26 age. And her education is, I am going to give BSc nursing. We all are BSc nurses, so I am going to give the BSc nursing. And her occupation is nurse. She is doing nursing job in a hospital. Name of her husband is, I am going to give Biju, and he is having 30 years of age. Let us write it here, 30 years of age, 30. Next is the education of the father. So here I am going to give MA. He did MA, and his job is teacher, and he is doing as a teacher job. Next, you can see the obstetrical history. Period of gestation, I am going to give 24th week of gestation. And after that, you can see the obstetrical score, gravida, para, GT, PALS. So here I am going to give G1 because my mother is primary gravida mother, T0, P0, preterm birth, P0, abortion, there is no any other abortions, so that's why I am giving A0. Next one is living. So here no any deliveries have happened, so that's why I am giving L0. Stillbirth, that's also S0. So because this is a primary gravida mother, that's why I am giving this type of obstetrical score. After that, we are going to write the LMP. So here I am going to give 12/6/2024. So this is her LMP, and the EDD will be 19/3/2025. So this is her EDD. So after that, the address you can write anything to here. I am not writing any addresses here. So this is our primary gravida mother. So that's why she is not having any past obstetrical history. So that's why I am writing primary gravida here. Sorry, primary gravida. So if puerperium was any abnormality, so there is no any other abnormalities. That's why I am nothing significance or nothing is there. Next page, look at here. So firstly, we need to write the general health condition of the mother. It's a fair condition. Height of the mother, I am giving 5 feet for the mother. Weight of the mother, she is 50 kg. Heart rate, her heart rate is normal. So that's why I am writing normal here. Lung sounds, that's also normal. Let us write it here, normal. The condition of the teeth, next is condition of teeth, that is also normal, or her condition is good. You can write it good here. Anemic condition, no, nothing significant, nil. Or edema, no any edematous conditions are there, so that's why I am writing no. Breasts are enlarged, or we can write enlarged. Next, bowel movements, normal. No any other abnormalities are here, so that's why I am writing normal. Bladder movements are also normal. Nothing significances are there. Next, presence of minor disorders, if specify yes. So here I am going to write vomiting because our mother is having vomiting. Next one is vaginal discharge, no any other vaginal discharges, so that's why I am writing no. Next is labor pain, no, nothing is there. So she is only having 24th week of gestation, no, so there is no any other labor pain. Next, temperature of the mother, I am going to write 90 78 degree Fahrenheit. Pulse 78 beat per minute. Respiration 18 breath per minute. And blood pressure is 110 by 80 mm of Hg. So this is our vital sign of our mother. Next one is we are going to write some investigations. So here you can see the normal investigations and normal values and patient's values. We need to write it here. So the normal value of the hemoglobin is 12 to 16 gram per dl. So here the patient is having 12 gram per dl. I am going to write 12 gram per dl of hemoglobin. Next, blood grouping or RH typing. So here she is a primigravida mother, so that's why I am not writing any other normal values. She is having a O positive blood. Next one is VDRL, so that's normally it is a negative condition, so that's why I am writing normal or negative. So the patient value is negative. There is no any other VDRL positive conditions. HIV also, that's also negative, and the patient is also having negative only. So next one is HbSAg conditions. So here also the normal value is negative and our patient is also a negative patient. Next one is blood sugar level. So fasting blood sugar level, normally you can see the fasting blood sugar level, it is 70 to 110, and our patient is also having normal blood sugar level. And next one is urine albumin level is, so it is less than 30. It is less than 30. So here our mother is also having normal condition only. The urine albumin level, it is normal. And next one is urine sugar level. Urine sugar level, so it is having 0 to 0.8 mmol. So this is the normal value, and our patient is also having the normal only. She is not having any other abnormal conditions. That's why I am writing this normal values here for the patients here. So next you can see the ultrasound findings or ultrasound examinations. If done right, significant findings. So here we are writing, because she is not having any other abnormalities, that's why we are writing the normal fetus, uterus and placenta. Next, any other investigations? Nothing did here, so no need to write it anything here. Next one is obstetrical examinations. So on the inspections, we need to write the size of the abdomen. So here our mother is having 24th week of gestation, so the abdominal circumference is 20 centimeter. Maybe it will be happen. The shape of the abdomen, it is enlarged, so I am writing enlarging here. Next one is counter of abdomen. So it is protruding because the uterus is enlarging, so that's why the abdomen counter is protruding. Next one is skin changes. So here in the abdomen we can see linea nigra and stria gravidarum on the abdominal areas. So let us write it here, linea nigra and stria gravidarum. The linea nigra is a dark line coming from the umbilicus to the pubic region, and the stria gravidarum are the scratch marks around the abdomen. So next we are going to write the palpation. Fundal height is 24 centimeter. Abdominal girth, it's having a large. Next one is position of the fetus. Here we can't write the position of the fetus, so that's why I am writing the upright position. And the lie, it may be longitudinal only, so let us write it here, longitudinal. Next is the presentation of the fetus. It will be cephalic. Maybe it will be changed also, because it is only 24th week of gestation. The patient is floating inside the uterine cavity, so maybe it will be changed. So I am writing it here, cephalic. Amniotic fluid volume, because it is 24th week of gestation, 500 ml. Previous scar, nothing is here, so I am writing no. And provisional diagnosis, there is no any other provisional diagnosis. So I am writing no here. Fetal heart sound. So in 24th week of gestation, fetal heart sound is 148 beat per minute. TT injection, see already did the TT injections are here, and the iron and folic acid tablets. So this is our second page. Let's see the third page. Here we are going to write record of prenatal visits. Record of prenatal visits. So here we are marking some records of antenatal visits. So first one is the first visit, date of first visit. So I am writing 2024 at 5th week of gestation, and the fundal height is too close to the pubic bone, that's why I am not writing here. Positions, presentation, nothing is there. Temperature is 97 degree Fahrenheit, pulse 78, respiration 18, BP 110 by 80 mm of Hg. So maternal vaccination she already did, that's why I am giving tick here. Next one is vaginal examination. We didn't do any other vaginal examinations, and the fetal heart rate is normally at the 5th week of gestation 90 to 110 beat per minute. And next one is any antenatal treatment if taken by mother. No, nothing is here. Next, second visit. Next I am going to write the second visit. So the date of visit is 25/8. At that time she was in 10th week of gestation. Fundal height is 10 centimeter. Position and presentation, nothing, we can write it here. Next one is temperature 98 degree Fahrenheit, 80 beat per minute is the pulse. Respiration is 18, BP is 120 by 80 mm of Hg. Maternal vaccinations, we already did it here, and we didn't do any other vaginal examinations. So during 10th weeks of gestation, the fetal heart rate is 158 to 172. So that's why I am writing the normal values here. And she didn't took any antenatal treatments. That's why I am writing it here. No. Let us see the third page. This is nursing care plan. I already took one of the PPT. So here our mother is having vomiting. So that's why I am writing a nursing care plan on vomiting. You can check it here. Next one is the last page. So here you can see the remarks, medical treatments and health education of the mother. So on the remarks, I am going to write the vomiting because the mother is having vomiting conditions. So whatever we did it here, we need to write it on the remarks. Next we are going to write the medical treatments of the mother. So what all are the medical treatments? She is already taking the iron, folic acid tablets, calcium tablets. So I am going to write it here, iron and folic acid. So here she is having vomitings. That's why we need to maintain her fluid volume. That's why we can give IV fluids if it is the vomiting is high. And antiemetics also we can give. Examples of antiemetics are promethazine, metoclopramide, ondansetron. So next we can do the medical treatment on dietary supplement. So we can give dietary supplement for the mother also. So these all are the medications we can give during the pregnancy time. More than that, we cannot do anything during pregnancy. Next heading is health education. So what are the health educations we can give to the mother during pregnancy time or during her antenatal visits? So first one is on nutrition. We need to give, or on diet. We need to give the health education on diet or nutrition. Eat balanced diet and supplementary nutritions we need to give the mother. And balanced diet and take a prenatal multivitamins, iron, folate, and avoid contaminated foods so we can control any other infections also. So for supplementary nutritional therapies we can start. Next one is rest and sleep. The patient may continue her usual activities throughout pregnancy. Next, bowel and bladder care. Regular bowel movement and bladder movement is good for the mother. Next, health education is on bathing. The patient should take daily bath, but careful against slipping in the bathroom due to imbalance. Next, upon clothing, shoes and belt. The patient should wear loose but comfortable garments. Next, we can give the health education on dental care and care of breast. If the nipples are anatomically normal, nothing is to be done. Next one is coitus. The coitus should be avoided during the first trimester. So we need to avoid the coitus during the pregnancy time. During all the trimesters, we need to control it. Next one is travel. During first trimester and the third trimester, the travel is not good. Next health education is on smoking and alcohol. It is not good for the health of the mother and the baby. Last one is immunization. So we need to give advice upon immunization of the mother. So these all are the health educations we can give to the mother during antenatal visits. At last, the students should do their signatures, and the signature of the tutor, she will give the signature here. So it's an easy way to write antenatal examination of a primary gravida mother. If you like my videos, please like and share it. And if any doubts, comment it on the comment box. If you are watching first time, please subscribe my channel. Thank you.